Tonight at 5, a warning for women: don't put off your mammograms. Local health officials are saying that many women are avoiding the life-saving tests because of COVID-19. 5 News reporter Catherine Gilker has the story.
Like many clinics, the breast center in Fayetteville temporarily stopped seeing patients. They reopened in June with extra safety measures like extra staff at the door to screen patients and cleaning around the office. They've also spaced out their appointments.
I believe that it's very important to catch cancers early. I came here today because it was time for my annual mammogram, and I have been called back for some extra testing.
Janelle Odell, like many women, don't ever miss their annual mammogram, but some women have been more reluctant to get the screening because of COVID-19.
We really feel that the risk of overlooking a breast cancer outweighs the risk when appropriate precautions were taken.
Dr. Britton Lott encourages any woman who hasn't had their annual mammogram this year to get one scheduled. She says screening mammograms are recommended once a year starting at age 40, regardless of your family history.
Patients who might be sitting at home during this pandemic thinking, well, I don't have a family history, we would really encourage them to still have their annual mammogram because a delayed cancer diagnosis can lead to a more difficult treatment path.
Dr. Lott says even in a normal year, women have a lot of stressors.
And in 2020, those stressors are so accentuated. I really want women to circle back if they're watching this and remember to take care of their own health so that they can keep taking care of the people around them.
In Fayetteville, covering news where you live, Catherine Gilker, 5 News.
Susan G. Komen estimates that this year there will be more than 42,000 breast cancer deaths in the U.S. That's why screening and early detection are so important.